All right, so low back pain. Low back pain, first thing that we kind of want to do a checklist on is our pelvis. So our pelvis is this guy here. If you can imagine it, that's as a bowl. Okay, so the bowl is going to tilt in certain directions. And what happens is it gets stuck in a certain direction and can no longer tilt, creating a stiffness that leads to back pain, particularly low back pain. Okay, so if we imagine, again, here's our bowl. I want to be able to turn and tilt the bowl without having to use my rib cage and upper body. So this is the motion that we're looking for. Again, if we're here, being able to tilt and being able to tilt. Okay. And when we do this on the ground, I want you to kind of be aware that we are doing that same tilting, and we're not trying to squish straight down. Okay? So, starting in low back position, lying on your back. Feet bent because it'll be a little bit easier. Again, try to relax your upper body. Make sure your head stays dead and doesn't help. All you want to do when you lie down is you want to notice, hey, is there naturally a tunnel in that low back? Just notice. If there is a tunnel, I want you to go ahead and squish it. And again, I squish it by turning my pelvis. So my tailbone turns up toward my nose. Make the tunnel, waistband goes away, tunnel forms, squish the tunnel. Head stays relaxed, ribs stay relaxed. Make the tunnel, squish the tunnel. Waistband away, waistband towards. So just go ahead, again, keeping your upper body relaxed. See if you can switch from tunnel to no tunnel with ease without having to use your arms, ribs, and head. It might take some time. Give yourself some grace. Try to figure it out. That pelvic motion is happening with your lower abs. Right, so upper abs is that crunch. My ribs fold upward. Lower abs is squishing the tunnel, and my pelvis folds upward or towards my belly button. So next time you get that squish tunnel, I just want you to hold it and breathe. If you cannot breathe and hold it, it isn't a true movement. If you're using your breathing muscles to hold it, your body will always choose breath. So you want to be able to utilize and hold, find and hold this position without having to change your breathing. Now while you hold it, go ahead and bring one foot up, knee in 90 degrees, and bring the other one up. Just hold here. Do not let that tunnel form. Do not let it cave in. Keep that tunnel squished and just hold. Some of you might be shaking right now, and that's perfectly okay. Again, this is trying to find the position. A body that was stuck in tunnel is trying to get out of tunnel and then do something in not tunnel, which is quite difficult. Go ahead and relax. And if you relax and you kind of collapsed, consider the work. Again, that idea of efficiency. You might need to find that tunnel and hold it before moving on to this next step. Okay? That was easy for you, and be honest whether it was easy or you're cheating. Squish that tunnel again. Bring both feet off the floor, knees 90 degrees. And now, tap one heel to the ground without moving the other leg. And switch. Again, do not let that tunnel form. Try not to cheat with your head, ribs, arms. Nice and slow, holding the position. Do about 2 more each side. Go as slow as you want to be challenged. Please don't move the upper leg while one is dropping. So you don't want them to move together and kind of collapse. And relax. Again, you should feel those lower abs working. You shouldn't feel tension work elsewhere. We're trying to isolate those lower abs by keeping everything else off. Last progression I'll give you if you're ready for it and or want to build toward it. And squish the tunnel, hold it. Get those feet to hover 90 degrees. And you have 2 options here. First is I'm going to straighten the leg, lower it straight, barely hovering off the ground, coming back up, both sides. Straightening and lowering. You might find, as I'm finding, one side is a lot trickier. You might get a hip pop. And the other, don't let that tunnel come up. Keep it squished. Version 2 is to simply extend. So again, really squish that tunnel. Drive one leg, bring it back. Reach with one heel, keep that tunnel squished. Bring it back.